Pets bring us so much joy. You know, when they're active and playful. When they're at peace, I am too. But when they're in pain or struggling with severe anxiety when they're home alone, something needs to be done to help them feel better. And now we have just what it takes, and it does not involve medication. Hi, I'm Dr. Jeff Nickel. I'm a veterinarian, and this is our family dog, Miss America, and one of our cats, Tony, and the other one, Gaston. He's hiding behind Tony. I'm residency trained in veterinary behavior medicine, and I've had a lot of years in practice in general medicine too. So if you have a question, by all means interrupt me, but I want to know who's attending. So tell me who you are and where you're from, and if you can hear me loud and clear, that's kind of important, hit the wow button, and if you find this information helpful, hit the heart button. So, you know, we've got this thing called the Assisi loop. Let me show you what it looks like. Here we go. Miss America's wearing one, but I'm going to show that to you in a minute. This is the smaller size. And this is something that is helpful for pain and inflammation, and you can use it right at home. Sometimes these things are used for treatment of spinal pain, neck and back. They're helpful for internal disorders like pancreatitis, inflammatory bowel disease. They've been used post-surgically to speed up healing and reduce pain and inflammation. And one of the most common uses for it is in older pets with age-related arthritic pain. So, who's watching here? Oh, this is Vicki Wells. Hello, Vicki. And Cassie. Excellent. Thank you for tuning in. So, I want to tell you a story because it really is a great illustration, in part because I know this pet. We go way back. This is a story about a cat named Kitty Girl, which doesn't sound particularly imaginative, except that these folks found this cat and hoped that they'd find her a home, so they just called her that. And of course, the home they found for her was their own, and the name stuck. And her people are Rita and Rob, and I met Kitty Girl back in 2009. Her people brought her in for behavior issues, which I'm going to read to you a little bit about it right now. And by the way, Kitty Girl is a real cat. That's her. And when you hear this story, you're going to think, could a sweet-looking cat like that behave sometimes the way Kitty Girl has? And, well, just listen up. I'll explain it to you. Rita was washing at the sink one day while Rob, her husband, was away on business. And suddenly, Kitty Girl jumped up and bit Rita on the back of the knee. Well, only 5 minutes before, Kitty Girl had been resting and taking a little afternoon nap. There'd actually been a thunderstorm earlier that day, and that might have been a factor. So, you know, after she got molested by our cat, she tried to pick up Kitty Girl and put her in the other room. And of course, each time she tried, Kitty Girl ran away. And in fact, when she tried to reach for her, Kitty Girl would swing at her and try to bite and hiss. So, I mean, have you ever had a cat like that? These things happen. That kind of aggression directed toward the cat's own person is not uncommon, and we have ways of working with that on the behavioral side. And we'll talk just a little bit about that. Well, it turns out Kitty Girl would scratch just about anyone who tried to handle her when she was aroused. In fact, she would stay agitated for a couple of days. On one occasion, a friend of Rob's came over to visit when Rob and Rita were home together with Kitty Girl, and Kitty Girl seemed like she was acting pretty sweet, and when this nice man reached to pet her, of course she hissed and, you know, took a swing at him. So they just had to manage this kitty and live with some of this. Despite all of that, Rita loves Kitty Girl and always has, and occasionally plays with her when Rob is out of town, because it turns out that Kitty Girl's always been in love with Rob. She's 18 years old now, and he has always been her one and only. Okay? So Rita sort of doesn't have a place in their relationship, but when Rob's out of town, she can actually pet Rita and actually get along with her and do okay. So one of the things that I did was to explain to Rita and Rob how to set up what we call feline environmental enrichments in the home, so that this cat could engage in some of her normal, healthy, appropriate feline aggression. So we got them to build floor-to-ceiling cat trees against windows, So they had a bird feeder or a birdhouse right outside, suction cup to the window, predatory hunt and pounce toys in the evening, hide boxes, multiple heights in different rooms. These are very important for cats. So we also talked, and I taught Rita and Rob how to teach Kitty Girl basic obedience, like come and sit. And if they had control over this cat when she might start getting ramped up, and she always earned a food reward for doing what she was told. Would you like that, Gaston? It's a little biscuit. Oh, that's a good boy. Oh, there you go. There you go. And you can derail many pets from inappropriate behavior by giving them a command, waiting for the response, and then giving them a reward. And they were very diligent. Rob and Rita both taught Kitty Girl how to obey, and she actually got pretty good at it. So I've got some things that Rita wrote that I'd like to read to you. We had a neighbor come to the door. Kitty Girl strolled up to her, gave her a sniff, stood with her front paws on the neighbor's knees, and then hissed. Well, fearing the worst, Rita told Kitty Girl to come, and she did. And then she told her to sit, and she did that. Then Kitty Girl hissed at Rita, but then sat looking disgruntled. Rob was then able to pick up Kitty Girl and put her in the other room. And when the neighbor left, Kitty Girl came back out, and she trotted downstairs to her food bowl like nothing had happened. So, over the past few years, Kitty Girl has slowed down a bit, according to Rita, and she no longer attempts jumping up on the dresser. Well, she's 18 years old. Her back legs showed some stiffness while walking, and like all cats who reach their senior years, Kitty Girl, her kidneys have started to fail, and it happens to all older cats. So, back to Rita and what she wrote on Kitty Girl. To get Kitty Girl to take her medication, we have to make it tasty for her, and she needs to think that it's her idea. So, Rob and Rita tried giving her pills early in her life, and according to Rita, it was a disaster. Her fear aggression causes any medical intervention to be too stressful for her and rather dangerous for us, Rob and Rita. Boy, have you ever had a cat like that? There are cats who are almost impossible to medicate, which makes the Assisi loop just invaluable. So, Rita goes on to say, as far as oral medications for her arthritis, we never found anything that she would take them in, so her uncomfortable joints remained untreated. Now, there's a problem, and it's confronted veterinary medicine since time immemorial. When we learned about the Assisi loop, we were hopeful that it would be a gentle way to help her old body feel its best. So, it only took a few days of using the loop before we noticed that Kitty Girl seemed more energetic and interested in things in the evenings after her sessions. She prefers the second floor of the house, but had stopped venturing downstairs at all. Now she'll take a little jog downstairs to have a look around and zoom back up like she used to. She seems to move more comfortably after treatments, and she jumps onto our bed with ease. She also plays more frequently and is interested in her toys again. As well as feeling more comfortable physically, she seems more mentally alert and engaged with us. And by the way, we understand how that works. The physiology of pain has gotten a lot of research, it's getting even more. That's part of what the Assisi loop is all about. But we understand how it affects behavior physiologically. Most of us know from our own experience that when we're feeling sick or painful, we can be a bit cranky and hard to work with. And so identifying and controlling pain in a chronically uncomfortable pet can have a whole lot to do with improving their behavior. So Rita finishes by saying that the best part about using the Assisi loop is that we have something we can actively do for her, since she would not be agreeable to most medical interventions. We're very proud of her and all that she's accomplished, even if she still swears like a sailor sometimes. So, again, here's Kitty Girl. She's actually a real beauty, and in the exam room, I never really had any great difficulty working with her. You know, she somehow can be cranky with people she doesn't know, but I never went to their house. So, let me show you a little bit about the Assisi loop on Miss America. Let me turn you this way, honey. There you go. I'm going to rotate the camera A little bit. There, sweetheart. So, Miss America here, you can see that she's, it's all right, sweetheart. She's, I'm a little bit nervous standing here like this, Dad. It's okay, honey. There we go. So, you can see that she's wearing this little black garment. This is called a loop aid. And the beautiful thing is that she has this Assisi loop on here. And you can see the device right here. And it comes with these Velcro tapes that you can use to position it wherever you want. And I have it over here over her middle back. Okay, sweetheart, you can sit back down again. That's a big girl, I know. I have it over that area because she has had a history of some narrow disc spaces in her back that had been causing her some pain. And the Assisi loop can not only improve the pain, but also the inflammation. That this is so much an important part of that. So, let me tell you a little bit about this thing. This thing puts out an electronic waveform that triggers the release of something called nitric oxide. It can go through a garment like the loop aid. It can go through bandage material, hair, even a cast. And we use it twice daily, minimum, 15 minutes each session. It's got a button on here that you push, and it, oh, there's the button. There we go. And it puts out this waveform for 15 minutes continuously, and it turns itself off. So you can use it twice a day. And it's harmless. There's no sensation associated with it. And it starts working within seconds. Or you can have a dog like Miss America wear the loop aid, this garment, if you will, with the bigger loop aid positioned exactly where you want it. And she can wear it 24/7. And she gets exactly 15-minute duration treatments every 2 hours. And the equipment takes care of the whole thing. You don't have to do anything at all. It's pretty handy. So this enhances healing, accelerates, it enhances healing, accelerates healing, diminishes pain and inflammation. And, this has been used in humans, the same technology. It's been very effective in people. And in fact, the researchers who discovered this usefulness of nitric oxide, they won a Nobel Prize. So this is serious technology. So what if my dog doesn't like the Velcro fasteners? Does the vest have to be worn? No, good question, Cassie. There are a few dogs where Velcro in particular, it makes that, and they kind of freaks them out because there are dogs who are noise sensitive. And if you wanted to, you could simply hold the thing over the area on your dog, depending on whether you use the bigger loop or the smaller one. It can, for example, if you have a problem on a dog's shoulder, in fact, if we can rotate the camera down one more time, raise that little, there you go. You can see that I'm holding this smaller loop. And so if Miss America had a problem with her shoulder or with her elbow, she can lay down next to me while I'm reading or answering email, and she can have these treatments twice daily without having to wear the garment. Thank you very much. So, the Assisi loop is a wonderful thing, and you've got these choices, and one of the most beautiful things about the way it works physiologically is that it triggers the release of the body's own natural opioids. We hear a lot about opioid abuse. Well, we produce them ourselves in response to pain. And by triggering the nitric oxide release, we're getting more of that effect in the body. So, it's really versatile. It's approved for use in cats and dogs and horses. And in fact, it's going to work for just about any creature with a pulse. So you're going to need a prescription from your veterinarian because we have to diagnose the pain and its location and understand what other treatments may be helpful. It can be used by itself, but it can also be used with other medications and other treatments. But it's something your veterinarian is going to have direct involvement in. But you can learn a lot more about it by going to assisianimalhealth.com. And in fact, you can send that web address to your veterinarian too, and the doctor can learn more about it as well before the prescription. Now, on the other hand, you've got separation anxiety, which is a very different problem that we can use a similar solution for. Separation anxiety, of course, is an overwhelming problem for the dogs and cats who are affected by it. And we have the Assisi loop, which looks like this. similar looking device, and I'll show it to you on Miss America in just a minute, who, by the way, does not have separation anxiety, but I have had 2 pets in my life who have, and I treat a lot of it in my behavior practice because it's extremely common. And these dogs just freak out when left alone. They panic. Some of them will do whatever it takes to escape the house, and they should never be crated because in their frantic attempts to escape, they've been known to fracture teeth and break nails and lacerate their lips. Can be pretty ugly, and we've got to treat them effectively, and we've got to treat them humanely. And nobody would intend to be harmful to their dog by crating them when they panic at home, but the effect it has is very unhelpful. So we've got the Assisi, from Assisi Products. It's called the Calmer Canine. And I don't know if anybody here, if you've had a dog like that, by all means, you're welcome to pop a question up there and I'll be happy to address it. But this is a device that sits on a special little thing called the Assisi vest. It's got a little Velcro loop, and you sit right behind the dog's head. And the positioning matters because where this thing sits, it targets the amygdala. Now, the amygdala is the fear center of the brain, and this is what it looks like. In fact, I'll turn the camera around so you can actually read the thing. There we go. And you see I have it circled there. It's that part of the brain, and by positioning the Calmer Canine right behind the head, we can target the pulsed electromagnetic fields to exactly where we want them to be. And it targets the nerve cells in that organ, in the amygdala. These are called the microglia, and it causes them to bind calcium to something called calmodulin, and that in turn leads to the production of nitric oxide. And you think, well, that's the same thing that we get when we use it for pain and inflammation and wound healing. Yeah, but those different tissues are going to respond differently to the different waveforms. We've got the duration and the frequency and the width of the waveform, and so it affects different tissues differently. So as much as these things look similar, they are certainly not interchangeable. You would not, if you had a dog who had pain and inflammation, who also had separation anxiety, you could use them both, but you would not use them at the same time. The Calmer Canine that you can see my little girlfriend here holding right behind her head. Can you sit up for a second? There you go, sweetie. It sits right behind the head. You don't ever wear this on a garment 24/7. This is 2 daily treatments, 15 minutes each. And like the Assisi Loop, the Calmer Canine has a button that you push, and it starts working. You can see the little light flashing when it's working. And like the Assisi Loop, though, they each turn themselves off at 15 minutes. So these things make it as easy as possible, and it's all at-home treatment. And the nice thing about the Assisi Loop, Calmer Canine for dogs with separation anxiety, is that you do not need a prescription for this. You can go to the Assisi Animal Health website, assisianimalhealth.com, and they will ship it to you. You don't need a doctor to prescribe it. These are safe, but the thing with the Assisi Loop is that we really have to diagnose where the pain is, and we have to know what part this plays in the whole treatment of the dog. So, you know, I'm really happy when I see developments and advancements in veterinary medicine. I love this work, frankly, because it gives me a chance to help pets and to make a difference in the lives of the people who love them too. And it's about kindness, isn't it? When we share kindness with pets, it comes back to us immediately. All of us pet lovers know that. But it also makes a difference for the people who are around us because they pick up on our example, I think even unconsciously sometimes. And so if we share kindness like that, gentle treatment, you know, it's good for everybody. So I think I have a couple of questions here. So yes, and you can purchase the Calmer Canine. There's a special website for it called Calmer, C-A-L-M-E-R, the letter K, and then the number 9.com. But if you go to the AssisiAnimalHealth.com website, you can read all about the Calmer Canine and the Assisi Loop, and you can purchase a Calmer Canine because, of course, the websites, they link to each other. And then when your veterinarian is ready to prescribe the Assisi loop, if your dog has pain, inflammation, wound healing, that kind of thing, then you can send the prescription in at assisianimalhealth.com. And can I use it on multiple animals? Yes, Liz, you certainly can. These things, they do have a limited battery life, but they've got a lot of uses. Now the difference is that you can see that this is an Assisi loop, and this is a small one. Clearly it's very handy for cats and for small dogs, but you could use it on a much bigger dog. It just can be a little harder to manage. The device itself that puts out the microcurrent is this right here, but there's some wiring in here that is essential to its function. But you know, for example, with Miss America here with hers, I got this. Can you stand up for me, sweetie? It's okay. There we go. And you can, it's all right. Yes, I don't like standing up on this chair, Dad. Anyway, with these Velcro tapes, you can position this anywhere on her that you want. So there's a lot of versatility, and in order to do that, they've got multiple different sizes for the loop aid, this little garment. And in fact, the little vest that goes with the Camera Canine, if you have a separation anxiety problem, you want those things to fit the dog, so these things are easy to use and they work properly. But yes, you can certainly use them on multiple pets. There might have been, I used to use Assisi loop for my cat's arthritis with amazing results. Wow, Anne, thank you for pointing that out. And I know that there are plans for a trial for cats of the Camera Canine loop. Yes, there are. But would it work now for my cat? I have a cat with separation anxiety that I don't want to use any type of medications on. I've tried L-theanine for a few days so far, not much help. Well, let's talk briefly about cats with separation anxiety, because you're pretty sharp to know this, by the way, because it wasn't that many years ago that it was assumed, even by the Veterinary Behavior College, that cats didn't get separation anxiety. Well, we now know that among the multiple different possible causes for urine soiling in cats, and it's the big behavior problem in cats, one of the causes is separation anxiety. And so when they get freaked out when they're home alone, they'll often urinate. And these are often cats who never urinate in inappropriate places when they're with their people, but when their person is gone, that's when it happens. Some of these cats also pace and yowl when they're home alone. And so a Camera Canine, I bet it's going to be called a Camera Feline if I were a betting man, I think it could make a huge difference on those. But it is likely that because the amygdala, the fear center of the brain, a cat's skull being much smaller than a dog's, they're going to have to use a different focal length, because these are targeted, don't forget, these pulsed electromagnetic fields. So the focal distance is going to be different, and they'll probably, with research, find that they're going to have to use a different waveform. So my suspicion is that the Camera Canine is probably not going to be the identical instrument on cats. But the research is not done and completed and published yet, and so we're going to have to wait for that to answer that question. Medication, it's not a last resort. Medication is one of many tools we have in behavior medicine. Environmental enrichments, like we discussed with Kitty Girl, to allow her to engage in her natural feline behaviors. Those enrichments are a huge part of treating separation problems in cats. One of the most common ones that I like to use, I think I've got it here somewhere. Here it is. Here's a food toy that we often put with canned or dry food, so the cat has to work hard because it isn't getting food from a bowl. Here's another one called it's a feeder toy, and it's called the, what the heck was this thing called, Carolyn? The feeder toy? It's called From Doc and Phoebe's. It's a feeder mouse. I think that's what we called it. Anyway, you put dry food in there, but you can also put frozen cat food in it, and it looks like a mouse, and so cats can engage in their natural feeding behaviors when they're home alone. So enrichments matter a great deal, but anxiety is a very severe mental problem. It is a physical disorder in the brain, and that's why something like a Camera Canine can make a big difference, adjusting the neuronal function, the function of the nerve cells in the brain. Excuse me, gentlemen. You're on camera. Thank you. People are watching. Really, the essence of everything that we do in behavior medicine and in other physical systems as well, is adjust what's going on internally. The brain, of course, is very much a physical organ. And whether we're using microcurrents from a targeted pulse electromagnetic field, or whether we're using a medication, or whether we're using behavior modification, such as the environmental enrichments that we provided for Kitty Girl, for Rob and Rita, or whether we're using the teaching of come and sit, and teaching the pet that they can earn a reinforcer when they follow a command from their person and abandon their focus on whatever it might have been. So if you've got a pet who's got separation anxiety, for example, and you can keep them occupied while you're gone doing something that's very natural to their species, like foraging, then that changes the way the brain functions, and that's why they improve. So you look at medications, and they can certainly play an important part by adjusting the neurochemistry, and in the right hands with the right knowledge. All of that can be done safely and appropriately. So these targeted pulse electromagnetic fields, the things that we get with the Calmer Canine for dogs with separation anxiety, or the Assisi Loop that is used for pets with inflammation and pain, wound healing issues, that kind of stuff, we're making adjustments internally. And this is very new technology, and it's just frankly so exciting that more is on the way, and that I'm pretty darn confident it's going to take a little while. Research, I've been involved in research myself and published it. I can tell you that it doesn't happen overnight. But if we can come up with something that'll help with so many of these cats who are freaked out when alone in urine soil and just feel miserable, and they feel better and their families feel better, then, wow, we've done a service for everybody. So, you know what it comes down to me is that when all pet lovers, we know this already. When you extend kindness to a pet, you are making it very clear to them that they're loved. And that comes back pretty much immediately, doesn't it? But what you may not realize is that that sense of well-being that you get from having shown that empathy and that kindness to those pets serves as an example to other people around you. It's something that they can carry forward even still. So kindness is something that makes a difference in everybody's life. And if you weren't the sort of person you are, spending your time learning this kind of stuff, well, you'd have more work to do on your kindness, wouldn't you? So thank you for tuning in. I'm Dr. Jeff Nickel, and this is Miss America, and this is Tony Gaston. He's right over here. And if there are more questions, by all means, go to the Assisi Animal Health Facebook page, and you are very welcome, in fact encouraged, to learn a lot more about the Assisi Loop by going to assisianimalhealth.com. And you will need your veterinarian to examine your pet and make a diagnosis if there's a pain or a lameness or an internal inflammatory problem. But the doctor can then prescribe the Assisi Loop for you. But the Calmer Canine for separation anxiety for dogs, you can go to Calmer Canine, that's C-A-L-M-E-R, the letter K, the number 9.com, and you can order it right there. And you can get started on your own. So if there are questions, though, once you get going with treating separation anxiety or any of these things, by all means put them on the Assisi Facebook page, and myself or one of the other doctors will take care of getting an answer for you. And it looks like there's one more. Melissa, we utilize our Assisi Loop for pain. 2 feet sprung toes, torn ligaments in a retired greyhound. Yeah, these things are, some of these pets, it's hard to medicate some of them. You remember the story of Kitty Girl. We couldn't get medication into her. And until, at age 18, until they found out about the Assisi Loop, Rob and Rita were not able to do anything to help their cat. And so, greyhounds are such splendid pets. I mean, they're so sweet dispositions. And the beauty of, like the Assisi Loop, for example, is that, you can just use it twice a day if you want to. They don't have to wear the Loop Aid, that garment that I showed you on Miss America. You can just sit with them morning and evening for 15 minutes and let this equipment do its work. And, very often people are noticing improvement right away. So, by all means. The nice thing about these targeted electromagnetic fields, these pulse electronic magnetic fields, whether it's the Calmer canine or the Assisi loop, is that there is no downside. We talk about medications, and they certainly have their place, but part of that discussion is always the possibility of side effects. Well, there isn't any with these. There's no sensation that comes out of them. They don't feel anything, not at the surface, and they simply feel better. And that's pretty hard to beat. So, another question. Let's see. I prefer no daily meds. Yeah, I can appreciate that. And so if you don't need the medication, if you find that the Assisi loop does it for you and for your dog, well, hey, you're done. And the nice thing is that you can keep using these products. You don't have to quit at some particular point. They're good indefinitely. So thank you again for watching. Any questions, by all means, Assisi Animal Health Facebook page. I'm Dr. Jeff Nickel, along with Miss America, my special Border Collie girlfriend, and Tony and Gaston, who's hiding on the other side of Tony. Thank you for watching.